Sure.
Hi, I'm Naisha McCauley, and you're watching AccessTV.org.
First of all, I want to say on behalf of the African American Affairs and the Commission on Health Equity, I would like to welcome you to this afternoon's reception for Dr. Helen Newton, the new Executive Director for the Commission on Health Equity. I am Glenn Cassis, the Executive Director for the African American Affairs Commission and Chairperson of the Public Voice Committee of the Commission on Health Equity. I am very happy and pleased that you joined us this afternoon to welcome an outstanding professional and a person to state government. Before I introduce this afternoon's speaker, I'd like to just welcome and introduce a couple of people here who are distinguished people. First of all, a commissioner for the African American Affairs Commission, Kristen Clark. Commissioner. And a good friend who's been on the forefront of a lot of issues in terms of health, and especially and lead poisoning, Dr. Vivian Cross. Dr. Cross. It would be an understatement to say that nationwide there's a crisis in healthcare and the delivery systems. In addition to not getting the best bang for our buck with the cost of healthcare, many people are denied proper care due to factors that should not be a part of the equation. I'm speaking about where they live, the language they speak, the color of their skin, the money in their bank account, and other social determinants that keep us apart. Hopefully, all of us will agree that healthcare is a right and not a privilege. But the sad truth is that there's a line drawn separating the traditional haves and have-nots. Until we are better able to address these disparities and close the gaps, we as a state and nation will never really come close to reaching our potential in human capital. I believe that with the addition of Dr. Newton at the helm of the Commission on Health Equity, the Commission is in a position to take action and do the work necessary to hold us all accountable for making health equity a reality. This afternoon, you will hear from a handful of stakeholders who support Dr. Newton and the Commission on Health Equity. At the same time, we encourage you to connect with us. The African American Affairs Commission has surveys and questionnaires on the table over here, and I ask you to fill them out and return before you leave. Also, we ask you to fill out the Commission on Health Equity sign-in sheet so that we can keep you in touch with what's going on with the Commission. Now I'd like to introduce our first speaker, Dr. Spivey, Dr. Maria Spivey. Dr. Spivey is the chairperson of the Commission on Health Equity by day and vice president of Health Equity for Connecticut Hospital Association, somehow by the same day. I'm not sure how he does that too, but she's able to burn it from both ends. Dr. Spivey.
Thank you. Good afternoon, everyone. Let's see, what do I do by night? I don't know. The Commission on Health Equity is a major force in this state, and it has been in existence for a few years now, but at this point in time, we are so excited to bring Dr. Helen Newton on as its leader. It is going to, we're going to be sure that we are working well with partners throughout the state and throughout the country. And I just want you to know that Dr. Newton is enthusiastic and passionate and a force to be with. So let me just say, in your programs, you see the mission of the commission, but let me just reinforce that. The Connecticut Commission on Health Equity was established primarily through the hard work of Senator Tony Hopp, who is now the mayor of the city of New Haven. It was established to eliminate disparities in health status based on race, on ethnicity, gender, and linguistic ability, thereby improving the quality of health for all of the state residents. So this is our primary mission, this is our vision, and this is our value. We are fortunate to have Dr. Helen Newton join us. As of November 1st is when she came on board. Some of us here in the commission were fortunate enough to be on the search committee to talk with Dr. Newton, and we were just blown away. So we are extremely happy that she is with us. She is a licensed physician surgeon by the Connecticut Department of Public Health, and that was in 2003, and skilled as a clinical ophthalmologist in the state of Connecticut. Dr. Newton is recognized for her proven ability to reach targeted goals, is recognized for high ethical standards in all work performed, is a talented and determined individual who accomplishes results in his business affairs and maintains computer literacy and a number of critical programs related to this work. She's skilled in problem solving and troubleshooting. As I said before, she is passionate about improving health equity in this state and is quite enthusiastic and is a no-nonsense professional. I want you to know that Dr. Newton, however, is not a newcomer to the commission. She has worked with the commission and the Public Voice Committee for the past couple of years, and she'll tell you a little bit more about that. But please help me welcome her now, and as soon as our primary speaker is on board, we will then hear from Dr. Newton. So thank you.
Since her appointment as Commissioner for the Department of Public Health by Governor Malloy in 2010, Dr. Mullen has shaped policy that partners with local health departments, community providers, professional societies, academia, and others to provide an integrated public health system that maximizes the public's investment in public health. We are very pleased to have Dr. Mullen, Commissioner Mullen, here to welcome Dr. Newton. Commissioner.
Thank you. Thank you for listing some of the things that we have been working on at DPH. And to Dr. Newton, who I first met on the day of my confirmation hearing because you came and introduced yourself to me and all this stuff was going on and we didn't get a chance to talk. I personally want to welcome you and welcome you to another kind of partnership with the Department of Public Health in your new role. And I think part of what Glenn Cassis just said about the work we've been doing over the past 3 years, I hope you'll find underscores the commitment that actually did exist within a lot of our staff at DPH before my arrival to advance health equity, to actually help people understand what health equity means to start with, but then not to just advance it, but to raise it so that in the same way that in the department, we don't take health equity as a project, but more so a value that's imbued in all the work that we do. We understand that your leadership at the commission will also be important because there are things that we can do at DPH that you can't do. There are things that you can do that we can't do, but in the spirit of it, not just taking a village, but a movement, I think that your presence is going to make a difference. And I would be remiss if I weren't citing and recognizing Margaret Hines, Dr. Hines, who is my designee to the commission, and Chris Andreessen, who I can't even describe in a sentence because you're so many things to so many people in Connecticut and all the partnerships that you have. But I just wanted to tell you that in my time, in addition to sort of pulling the work of health equity out of a department, you probably know, created an Office of Health Equity, Research, Evaluation, and Policy, which is led by Dr. Hines. As we rewrote our vision and mission statement, you may also understand that there's a health equity portion to the mission statement for the Department of Public Health now. And as we embarked on a strategic mapping process for our work, we invited your predecessor, to be a part of that visioning and mapping. She was also invited to the work that we did earlier this year as we embarked on our state health improvement planning. So I know that you have a lot of new things to learn about state agencies, so I wanted to make sure you know that you are welcome to have us convene a meeting with some of the DPH staff so that you can come and learn more about us. And I brought you a few things. So, and you might have them all already, but one of them is our strategic map. And you'll see that one of our cross-cutting priorities is health equity. Along with that, I did bring you our mission statement and vision statement. And for those of you who don't know what I was referring to in our mission, it includes promoting the equal enjoyment of the highest attainable standard of health, which is a human right and a priority of the state. And for all of you who have memorized the Connecticut general statutes, what this really reflects is that Margaret Hines has reminded us that this is actually in the Connecticut law, and it's part of our statement. And then earlier this year, we did create a document for the commission that really goes through a number of domains in our health equity work. And you may have seen it already, but now you have a hard copy from me with my card. From personal experience, I will tell you one of my favorite four-letter words after I started this job became PACE. So I hope you pace yourself, because I know that you are entering into all kinds of expectations, but I know that there are all kinds of willing partners for you here, and I want to welcome you and thank you for taking the position.
Thank you, Commissioner Mullen. And another four-letter word I learned when I moved here, which you can use, is help. No, seriously, if you do need help, I think all of us that are here supporting you will certainly be upfront and be there for you. Right now, I'd like to introduce another important partner to the Connecticut Commission on Health Equity, and that's the Department of Social Services. Through DSS, many people throughout the state receive services. Speaking for Commissioner Brembley is Kate McEvoy, Interim Medicaid Director. Kate?
Good afternoon. I'm very honored to join Dr. Newton and all of you today, the other esteemed speakers, representing Commissioner Rod Brembley of the Department of Social Services. My name is Kate McEvoy, and as Glenn said, I'm the Interim Director of the Division of Health Services at DSS. We have oversight of the Medicaid program. DSS celebrates and affirms your appointment, Dr. Newton, to the critical position of Executive Director of the Commission on Health Equity. As a clinician and thought leader, it is evident that you bring unique capabilities to this critical position. DSS health reform agenda emphasizes three critical strands: access to primary care, integration of care, especially focusing on medical care and behavioral health care, and also rebalancing of our long-term services and supports. In each of these focus areas, it is imperative that we are deeply and affirmatively attuned to the need to achieve health equity for all recipients of state-funded medical assistance. Today, we are serving over 640,000 individuals on Medicaid. That's 17.6% of the entire state population, and 4 out of 10 births to Connecticut women are covered by the Medicaid program. It is essential to achieve equity in the eligibility process, in access to care, in care experience, and also in outcomes. AACA has afforded many tools through which equity can be supported. Expansion in Medicaid income eligibility for childless adults, effective January 1st. Enhanced funding for primary care. Support for innovative models of integration, just to name a few. AACA has also promoted a landscape in which we are appropriately cued to the need to incorporate population health strategies. And I'm indebted to Dr. Mullen and to her colleagues at the Department of Public Health for helping us to educate ourselves in this vein and to attend to social determinants and take a whole person view of the individuals whom we serve. DSS stands ready to learn from you, Dr. Newton, as well as from the Commission, and to partner in support of health equity work via diverse initiatives, a few examples of which include the administrative services organizations that are currently managing our medical, behavioral health, dental, and also medical transportation benefits. Our person-centered medical home initiative, which is enabling transformation of primary care, and a key facet of that is improving upon the care experience of all people seeking primary care. And also our Rewards to Quit Tobacco Cessation initiative, a key aspect of exploring other means of engaging with beneficiaries through incentives. Additionally, however, DSS seeks to collaborate with Dr. Newton and the Commission on outreach, patient engagement, and education work. In reading the annual report and the projection for 2014, initiatives like the Health Disparities Sabbaths, the Primetime Sister Circles, these are enabling means through which this work remains informed by and accountable to the people with whom we work, the people whom we serve. Cheers and best wishes to you, Dr. Newton. As you embark on this path, we stand ready to partner with you in every aspect of your work. Thank you so much.
Next, I'd like to introduce a real partner who without who we wouldn't have a home. I'd like to introduce to you Vickie Veltri, healthcare advocate, and our landlord, I guess. Vickie.
Well, welcome everybody. Welcome, Dr. Newton. And I think I may have said welcome a bunch of times. I was so thrilled to see Dr. Newton be appointed as the new Health Equity Director, because we desperately need someone in that position. It is it's such a unique opportunity the Commission on Health Equity offers, because it's such a collaboration among all entities in the state. It's sort of a unique place to drive change and to drive legislative action. And I'm telling you that standing here today, I stand more than willing and ready to partner with you on legislative work, whether it's budgeting, whether it's activities that need to happen to realize the dreams, the hopes of our residents on health equity and other issues. We stand ready to partner with you. It's interesting because Dr. Newton is the first day. The first day in state employment is always an experience for people who come from private sector. So getting used to the new office location, where it is, the parking arrangements where we work, and calendars and Outlook and tracking things becomes another experience unto itself. But I think that what we have now is the ability to really make a difference this year. Right away, Dr. Newton, on the first day, was working on comments to the State Innovation Model initiative that our office is directing, but we hope to have health equity be a cross-cutting issue on, and a cross-cutting tactics, strategies to try to really embed health equity across all areas. On her first day, she was asking me how to comment on it, where can I get more information, what can I work on? Her energy is really tremendous, and I think that you have now a new partner to work with and push ahead on health equity issues. So we stand ready to work with you. In the Office of the Healthcare Advocate, obviously, while we address certain kinds of issues really, really well, one thing that we need help on is ensuring that all our activities have health equity embedded in all of them. And so you sitting right next door to me makes that an even better possibility. So, as I said, I welcome you. The Commission has my commitment to ensuring the really great partnership moving forward, and I'll see you back at the office.
Before I introduce our main reason why we're here today, I just want to give you just a very brief story of how we first met. This goes back probably about 3 years ago. At a place that most people wouldn't even think we would meet. It was a Saturday, so I'm starting to tip it off where it was, and it was in the winter. And I had just finished doing a ski lesson out at Ski Sundown. So I decided to come in and sit down and eat. But as you know, you don't see many folks who look like me out at Ski Sundown or really any place. So I did see someone who had a mustaches. There we go. No, plenty of mustaches. But anyway, I saw a woman sitting there. She was reading a book. And I said, "Oh, man, I just introduced myself because I don't see many folks like this." We started talking, and with that New York accent, I just said, "Oh boy, we got a close relationship here." So we started talking and explained, and she said she was interested in health and things like that. I said, "Wow, that's a small world," and we got to be friends there. And that's the first time we met. And she wasn't skiing though; her son was. He was doing some snowboarding, and we had an opportunity to talk and things like that. So I knew this was a good person, a person who is well-rounded, who's not afraid to take risk and get involved. And since then, we've been good buddies. So without further ado, I'd like to introduce to you Dr. Helen Newton, the new Executive Director for the Commission on Health Equity. Dr. Newton.
Well, it's with great pleasure and gratitude that I really want to thank each person from the bottom of my heart for taking out the time this afternoon to come to welcome me both to the state and to the Commission on Health Equity. I thank you for your kindness, for your patience, and also for the thoughtfulness of doing this. But today I want to touch on 3 items very briefly that I feel are very important. One, I want to talk a little bit about myself so that you can know me a little better. I want to talk a little bit about equity versus equality. And I also want to talk about the upcoming plans that we have in the Commission for Health Equity. So as you already know, I am from the Northeast. I'm from the Northeast part of the Bronx, I should say. And so a lot of people do comment on the fact that I have an accent, even though I personally don't hear it. But that's okay. I've lived, as you know, in Connecticut for about the past 10 years, and I'm an ophthalmologist by training. But today, standing in the Legislative Office building, I want to talk about another side of my family that I have actually never spoken about in public. I am a member of the Page Nelson Society. In order to be a member of the Page Nelson Society, you have to be a blood relative of either Thomas Nelson Jr. or John Page Jr., both of which come from founding families of America. They have been in the past both governors of Virginia, friends to Thomas Jefferson, family members to George Washington, and the list goes on. John Page was a founder of the College of William and Mary, and Thomas Nelson is one of the signers of the Declaration of Independence. But what that membership did for me, well, first of all, you can only imagine the faces of my family members when I walked in with Mormon genealogists to their family reunion and with my claim that I was their long-lost relative. Well, I don't have to tell you that it made for a memorable family reunion. But what I learned is that I saw how the ideas of a few people, that they made ideas over vacations, over just visiting one another, became an idea that went to the legislative body that became the law of the land. That although they were merchants and they were plantation owners, they were also responsible for the institutionalization of enslavement. And that's the part that we don't often see or hear about in the history books. But that piqued my interest, and it made me want to understand more on exactly how this small group of people were able to do that. I am sure from reading some of their letters and memos that when they did it, they had no idea that this was going to have the effect it had on the state of Virginia or the effect that it's had on this entire nation. It was something that they put together to take care of a problem that they were having at the time. But one of the things that I've learned from reading and studying their work is that there is an inextricable when you have the inextricable intertwinement of racism in the medical, educational, and justice system, it will automatically lead to propagate an underclass. That if you want to see change, this was implemented from the top down. So if you want to see change, change comes also from the top down. It has to be done in the same way that it was implemented. The second thing that I just want to touch on briefly is about equity and equality. A couple of weeks ago, I had the opportunity to do a presentation at the African American Affairs Commission. And the Chairman Pierre Louis, asked what I think is a very important question. He, at the end of the presentation, asked the difference between equity and equality. And I thought that that was significant because I said if one person is brave to ask the question, there's usually other people that have the exact same question. And so I'd like to talk about that just briefly today. But equity, as you know, is the fair and impartial treatment by definition. Equality is the same treatment. So in equity, though, there is a need for equity in this instance because we have people who, wait, let me back up. Fair and impartial treatment is subjective. So the minute that you are looking for other people to make the call of what's fair and impartial, at the end of the day, we run the risk of putting ourselves in a position that we have not progressed much farther than where we already are. The term equity was first used many years ago in the women's rights movement. They felt that because of the anatomy of women that they could not be treated equally. So they came up with the word equity instead of equality. We know that then that was rejected and that women fought for equal treatment. We know that Martin Luther King, we know that Mahatma Gandhi, we know that Nelson Mandela and other people, they lost their lives, and they didn't lose their lives for equity. They lost their lives for equality, for equal treatment, for the same treatment, for equal opportunities, for equal access. But we also know in order to get to equality, we have to have a process. And equity is that process that allows us to get to equality. We know that the Emancipation Proclamation gave us the legal framework for freedom, but it didn't put in place a process for justice or equality. We know that the Civil Rights Act of 1964 gave us equality, the legal framework for equality, but it did not give us a process by which to achieve that equality. And equity is a political, some people will say, or a social process that allows us to achieve that equality. And for that reason, I am very happy and very thankful that we have that process in place. That process looks like community health activities, like better housing, improved education, all of those factors that are necessary for us to reach equality, to enjoy the highest quality of life that's attainable for each person. That's what we need to do. My last point that I'd like to make has to do with the Connecticut Commission on Health Equity. Presently, we have, well, I've been there since November 1st, and the commission has the legislative authority to look at policies, activities, resource allocations to see how those entities impact disparity, health disparities in particular. That is what we're legislated to do. I have found that there have been several organizations that have been very helpful. They have been head and shoulders above everyone else in terms of participating in the health equity plan that was put forth by the commission even before I got there. And I would be remiss if I did not mention some of the organizations who have really participated in the health, have partnered with the commission and put forth work. They have produced work, and first and foremost would be the Department of Public Health. And I did have an opportunity to look at the health equity policy statement, the health equity plan, and the impact statement that was signed by you, Commissioner Jewel Mullen, and I did have an opportunity to read all of it, and we're very appreciative for that work because it goes beyond just conversation. It was the production of actual policy, and that's what we're talking about. But they weren't the only ones. In all fairness, we had DMOS, the Department of Mental Health and Addiction Services, who did outstanding work also and put forth that information. We have the Office of Healthcare Advocacy, who have also participated in that. And we have Department of Education and DCF. So out of the 11 organizations that we are initially focusing on to evaluate each of those entities, we are very happy that we're about 50% of the way past our planning phase. We are looking at those 5 organizations that have completed this, what we call the planning stage, to move on to the pre-implementation stage. And in that stage, it will involve more work. We're going to look for organizational analysis. We're going to look for output. We're going to look for throughput. We're going to look for outcomes. And to see how the outcomes that you're having now are actually impacting disparities in the state. Though we are, in terms of partnering, we are very interested in doing partnerships, and I actually feel that this can't work without the partnership of everyone. This can't work without everyone being willing to roll up their sleeves and to work. And I think that that's an important part of it, because everyone wants change and everyone talks about change, but I'm hoping that when you see my phone number there, that you will actually pick up the phone and answer, because I will, and the commission will, we will all need help to do this. But I do believe that when we do it, it will be worthwhile. After the pre-implementation stage, which will also include training in advanced class standards and implementation strategies for departments to actually start thinking through what this will look like at the end before we even begin doing it. The last phase is actually the implementation, and it's the implementation of the enhanced class standards, is what we call it affectionately, but it's known as culturally and linguistically appropriate services. And we have an expectation that all of the services that are provided to the residents of the state of Connecticut will be culturally and linguistically appropriate. Happy to be able to have a number of benchmarks, clearly defined benchmarks that have been produced by the Office of Minority Health. They put out the first set of benchmarks in 2000, and then it was redone to include a lot of the advancements that had been made in 2010. The guiding principle for that is, I believe, pretty simple, is to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs. We believe that the class standards will provide a benchmark by which we can measure the progress that we're making. There are 3 important domains that are in the class standard. The first domain, if you will, is governance, leadership, and workforce. The second one is a communication a piece, and that's the one that we're actually most familiar with, because most hospitals are already using the communication piece. And in the state of Connecticut, we're one of few states in the nation that have to have, the physicians have to have cultural competency, CME, in order to be licensed. So in that regard, it's something that's already in effect in many of the hospitals in the state. So there is a familiarity with this. The last part of it, which I feel is the most important part, is the continuous ongoing monitoring, improvement, and accountability. And without those 3 things, nothing really is sustainable. We need it to be a continuous process that is in place in each of the departments of the state. Of course, this does not replace a bottom-up approach in terms of the social determinants of health. But we know that in terms of change, if you want to see change in an institution or in a department, you have to change the head. You have to start at the top, and then everything else will work down.
So the ultimate goal is equality and justice for all residents in the state of Connecticut. In closing, I remember these words. We hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. I'm thankful to be in a state with a governor, lieutenant governor, commissioners, legislators, senators that are open and willing to change. It really makes a difference. I'm also very happy to be among people who are committed to the process of equity, but will always keep their eye on the end goal, equality. I thank each one of you again who attended to show your support and extend your welcome, and I do in fact feel welcomed. So I thank you, I wish you all a wonderful holiday, and I look forward to each of us working together. Thank you.
She packs it, doesn't she? Dr. Newton, again, thank you for being here with us, and we look forward to your leadership on the commission. And for everyone, I'd like to again say have a happy holiday. We have plenty of holiday treats here. We have this room until probably about 2:30ish or 3 o'clock, so if you want to hang out and talk, please feel free to do so. Again, thank you very much for coming.